Hello, audience. Today is the next episode of Dr. Fazil TV show. As you all know, my name is Dr. Fazil. Not only specialized in, I have not only specialized in internal medicine, but also in kidney conditions known as nephrology. So I'm also a nephrologist. So over a period of time, I've seen all kind of different kind of medical conditions. Obviously, for the last 3 years, we've been struggling with COVID-19 epidemic. Now we're heading in 2022, and we did multiple episodes of Dr. Fazil TV show on COVID-19. And recently, obviously, as you all know, we have a new version, Omicron, another version of Delta virus, which has a lot more mutation, a lot more concern about its transmission, and what would it have long-term effect on us as we know it and over society. Welcome to Dr. Fazil TV show today. So let's start with the basic first. Most patients have been asking why the name is Omicron. So this is actually a Greek alphabet. So in Greek language we have 24 alphabets. Alpha, beta, gamma, delta. The delta was the fourth one. Omicron is number 15, and lambda version, which I talked about in the past, which we never got a good coverage on the big media, was the lambda version, which came from South America. Omicron was discovered recently by the virus hunters, we call them, in Netherlands, actually, in November of 2021. And after that, it was was reported by South African countries. As a result of that, we have a flight restriction to South African countries, as we know that. But the matter of the fact is that it was already discovered before that in the European country, Netherlands. And South African countries are the one who actually blew the whistle. But they get, obviously, flight restriction and travel ban, which is kind of like the same concept as we had in First World War, when we have Spanish flu, which was worldwide, and Spain was the only country which did not have that. When they reported to the media and to the world that there was a virus going around which is killing people, and since Spain was the one who was saying it, they named it Spanish flu. And now everybody thinks that Spanish flu came from Spain. It did not. They are the one who educated the world or told the world that there was a flu or virus going around, which caused a lot of casualties back then. So coming back to the origin of Omicron, Omicron apparently came from those countries which has been either have no vaccination at all or have partial vaccination. And because of that reason, the Delta virus, which is I will call it the smart virus, it has changed to a next level version, and it has on the spike proteins, which is the protein on the outside of the virus, which has the first contact with the human body, known as spike protein, as you can see in the background. That spike protein has 32 mutations. In total, this Omicron has 50 mutations. 32 alone is on the spike protein. And remember, the spike protein antibodies, what we get is from mRNA vaccine, is the what which give us the vaccination status, which is what protect us. So if that protein has changed, obviously we have a concern that our previous exposure to Delta virus or vaccination might not have that much effect or no effect at all. So this is still in the air. So we should be ready with the new technology to fight back with this new, highly transmissible, possible more deadly virus.
Now you can catch up with all of our previous shows on all Roku devices. Simply search for the Dr. Fazil Show channel and add it to your home screen. View our videos online by visiting our website at www.drfazilshow.com. Our videos are available on YouTube by searching for The Dr. Fazil Show. And don't forget to subscribe to our channel. The Dr. Fazil Show is available in multiple provider office waiting rooms across Yuma, Arizona. Don't forget to get your copy of Health Tips magazine and read about this interview, currently distributed across Yuma, Arizona.
So coming back to the name from the Greek language, alpha, lambda was number 11. This is number 15, Omicron. And last alphabet in Greek language is omega. That's number 24. So that is the worst one. So I'm concerned that hopefully we never get omega virus. That would be the last and most lethal virus in the sequence we are going now would be out there. So let's not get to the omega virus. Let's fight back with the Omicron virus now. And how can we fight with the Omicron virus? Old-fashioned tactics would work even now. Masks, social distancing, trying to not be in the crowd, especially in indoor setting. That will still work. That will work for any kind of virus which get transmitted through inhalation. So we cannot 100% rely on the vaccination, and we know some people have an issue with getting vaccination, and I understand the reason, because it might have some side effects which we don't know at the moment, or they're not widespreadly known at the moment, because we don't have enough time frame to see the long-term side effects. So with or without vaccine, we still have to protect ourselves, and winter is here. And we have to fight with this new version in the winter when all viruses get more commonly spread, including the flu. So my message to the audience is, while the virologists and medical specialists are working on this new version of the virus, Omicron, we do what we need to do. Protect yourself, mask, sanitization, social distancing, staying away from the crowds, and try not to be in an indoor setting with a lot of people with poor air circulation. So that's the basic hygiene. That will do a lot of prevention of spread of this virus. Obviously, there are a few more mandates coming in. For example, you have to do the PCR testing within 24 hours instead of 72 hours for people coming to USA from other countries. Either they are US citizens or non-citizens. So they're trying to make it more harder, more robust screening mechanism in place, so we can isolate those infected people before it gets spread. But as we know from previous versions and our previous experience, when we find virus in one person, in one place, the virus is already spread. There's no way you can stop this virus. It's going to be already global. It's already spread to 16 countries. So if it's already spread to 16 countries, we already have few cases in the USA, is more transmissible than the Delta virus. We know it's going to be spreading everywhere. It's just a matter of time. The incubation period, that period of time when you get the infection, exposure to infection, and by the time you get symptoms, is 2 weeks. Since we have more intermingling during the holiday season, Christmas, New Year, obviously this virus has a perfect, I call it the perfect storm, like highly transmissible virus. We don't know if it's going to be reactive to the vaccine or not, but at the same time, we have those holidays where we all get together. So let's be safe. Let's fight together with or without vaccine. Obviously, booster vaccine is recommended at the time because it will boost up your immunity. So let's do it. So with that note, audience, let's fight. Let's be careful. Let's be safe. And God bless you all. Thank you for watching this show.